the Delta variant now makes up almost 100% of new COVID cases here in the UK. It's rising pretty rapidly in Europe. In France, it now makes up 20% of new cases, even more in Germany and more in the United States. When is it likely to become the dominant strain in Europe and the US?
Well, thank you for having me. What we saw here in the UK was that, the initial introduction of cases of the Delta variant, which we think arose in India, happened in April. And so it really only took about 2 months before it became the dominant strain. It's just so much more transmissible than the other strains out there that it has these fitness advantages that allows it to outcompete other variants. So if this is a test case, particularly here in a place where the vaccination campaign has been successful and the rates are high, we could certainly see the Delta variant become dominant in other countries that are already having levels of community transmission in a matter of months.
Well, the UK is far ahead in terms of its vaccination rollout compared to Europe and compared to the United States. So when we talk about the Delta variant becoming dominant in those places, just how bad can the health situation get?
Well, you only have to look into what happened in India over the last couple of months to see how bad it could be in a situation where the rates of vaccinations are very low. The health system was absolutely overwhelmed. There was a tremendous amount of hospitalization, death, oxygen shortages, etc. So that's a real concern around the world, particularly in the global south, where there hasn't been good access to vaccinations yet. But even in other parts of the world that have vaccination campaigns ongoing, there's a real significant concern here. I mean, you think about the rates that we have of vaccination in the UK, we're still seeing exponential growth in new cases. Now, fortunately, because of the high levels of vaccinations, particularly in middle-aged and older adults, we're not seeing big rises in hospitalizations and deaths at this time, but they are still going up. We've talked a lot about the idea of herd immunity, a threshold in the population of having an immune protection that might allow you to kind of break the back of the spread of a pathogen like SARS-CoV-2. Oftentimes, we talked about that being about 70% of the population, give or take. Here in the UK, we have about 50% of the entire population who's been fully vaccinated. So we're not even there yet. The big thing, though, is with a more transmissible variant like Delta, that herd immunity threshold is probably even much higher than 70%. So in the race between vaccinations and variants, I worry that we're falling behind here.
Well, that point about herd immunity is certainly important, and I think one of the key pieces will also be how reinfection risk plays out and unfolds, and perhaps that contributes as well to the difficulty here. So, I mean, lots of people are concerned about people who've been double vaccinated and are still coming down with the virus. Is this a cause for concern in your view, or is this really what we expected? Is this the vaccines working as they were supposed to because they are by and large preventing hospitalization and death?
Yeah, so first of all these vaccines are tremendous, and let's still reflect on the miracle of science that brought us this far. They're all tremendously effective. Now, the Delta variant does have a bit of immune evasion, so the vaccines are a little bit less effective with this variant versus other variants, particularly once you've had two. But none of them are 100%, right? We're talking about the 60 to 80% range, even after a double jab. So it's, for anybody who's been double vaccinated, there still is a small individual risk of developing infection if you're exposed. And when we see high rates of transmission, as we're starting to see across the country, what we can expect is that even though it's going to be a smaller fraction, that we're going to see an increase in the number of cases of people who have been double jabbed who are still coming down with COVID. However, as you said, the good news is that it does provide excellent protection, these vaccines, against severe disease, hospitalization, and death. And so the hope that the government is really betting on is that they can tolerate rise in the number of cases because it's not going to put lots of people in hospital. I think one of the big risks to that approach is that we know that the higher the levels of transmission, the more lottery tickets we're given this virus to further mutate. And then the next variant, which is even more difficult to manage, could be right around the corner.